Hi, my name is Alan. I'm from the Florence Darlington Tech Respiratory Care Program. I'm one of the instructors. And we are going to demonstrate today how to do a medication aerosol checkup. The first thing we're going to want to do is, if we get a requisition to do a medication aerosol, we're going to take that requisition and we're going to go to the patient's chart and we're going to verify the physician's order for appropriateness. So I'm going to go to the chart, see a valid order for this medication aerosol, the type of medication, the amount, and then I'm going to look for indications as to why am I giving this breathing treatment with medication to the patient. After I have identified the indications, I might look and see if there are any contraindications, things I need to be concerned about with regards to giving this medication. After I've done that, I'm going to make sure that I have the right patient by getting maybe a sticker that has the patient identifiers on there, name, date of birth, patient medical record number, patient identification number, and I will take that information and my order now that I've verified, and I will go and gather my equipment. To do a medication aerosol, I will need to get a aerosol device, medication aerosol device. This one's an Aero Eclipse. This one can operate as a continuous neb or as a miser, which will only allow the patient to get medication on inhalation. For this therapy, we will use it as a continuous small volume nebulizer. I will also have a mask in case the patient cannot use the mouthpiece. I can switch to a mask, which will allow the patient to get all the medication. I need to have my medication, which I would get from a Pyxis. At most hospitals, that's where the medication is being stored. And I will also have a pulse oximeter, my stethoscope, and I also would have my watch on, which I do not have on right now, but need to imagine that I do. And I'd have a watch on so I can take the patient's vital signs. I will also have to have a peak flow meter, which this will measure the patient's peak expiratory flow rate. And this will allow me to see the pre and post treatment results of the patient. Did they improve their exhaled flow post the treatment? After I have gathered all my equipment, I will then proceed to the patient's room. I will go to the patient's room. I will knock on the door. Hi, my name is Alan. I'm from the Respiratory Care Department. Are you Miss Stacy?
Yes, I am.
Okay, great, Miss Stacy. I'm here today to give you a breathing treatment. Have you ever had breathing treatments before?
No, I have.
Okay. Well, it's going to help. Your physician felt it was going to help you breathe a little bit better. So we're going to give you this breathing treatment with a bronchodilator named Provenal. But before I do that, I have to go ahead and wash my hands. I'll go over to the sink. I will wash my hands for 15 seconds. And after I've washed my hands, I will proceed to the patient and say, ma'am, I need to just go ahead and check your ID. And it says here that your name is Stacy. And what is your date of birth, Miss Stacy?
March 7th, 1972.
Okay, very good. I have identified the patient, and at this point I'm going to explain about the treatment, the indications, some of the concerns, hazards that she needs to be aware of. Miss Stacy, we'll be giving you a breathing treatment with a mouthpiece. It looks like a pipe. It's a bronchodilator. It's going to help open up your airways so that you're able to breathe a little bit more easily, and you'll have probably be able to take a deeper breath in. Sometimes when patients take this medication, they might feel that they might get a little jittery. Their heart rate might increase a little bit. They might feel a little tingly. But if you start feeling anything out of the abnormal, I need you to let me know during the breathing treatment and follow my instructions, and we can stop the treatment. It's not a race. Do you understand?
Yes, I do.
Okay, great. If there was a family member in the room, I would go ahead and confirm with the patient it's all right if your family member stays here. And if that was okay, I would confirm with the family member that they understood. At this point, I would go ahead and do my assessment of the patient. I would check the patient's heart rate, respiratory rate, saturation with a pulse oximeter, putting it on her finger. I would check her level of dyspnea on a scale of 1 to 5, 5 being the worst. How do you feel right now with regards to your ease of breathing?
I feel like it's a 3.
3? Okay. Well, hopefully we'll see if you feel better after the breathing treatment. At this point, I would also note the color of her skin, checking for some slight discoloration around the lips and the fingers, the nail beds. At this point, I could set up my equipment, and what I'm going to have to do is I'm going to do a couple of things. I'm going to listen to her breath sounds, take my stethoscope. I'm going to ask the patient to open their mouth, take a deep breath in, and then exhale fully. And I'm going to listen to her on the front, here, and here. Okay. Now I'm going to ask her to lift her arm up, and I'm going to listen again. Okay, and one more time. And then I would listen to 4 on the back. After I listen to the breath sounds, I would ask the patient, I would instruct the patient as to how to do a peak flow meter reading. And a peak flow is going to measure the peak expiratory flow rate that the patient can do. Miss Stacy, what I need you to do is I need you to take this in your hand. I want you to hold it tightly. And then I want you to take a deep breath in, and when you do, I want you to take that mouthpiece, put it on top of your tongue, bite down, make a tight seal, and blow out as hard and fast as you possibly can. Do you understand what I'm talking about?
Yes, I
Do
do.
you have any questions?
No.
Okay, so put it in your mouth, bite down, deep breath in, blow out hard. Okay, great. Miss Stacy went ahead and did 420. I would have the patient do this 3 times, and after I've had the patient do it 3 times, at this point I would set up my aerosol nebulizer and give Miss Stacy the breathing treatment. I'm going to take my nebulizer, using aseptic technique. Take my medication, open it up. You see how I'm not trying to touch anything in the inside. I put my medication in, full unit dose. Take my top, I put it on, and I rotate it until it's closed. I hook it up to the flow meter, and at this point, I would tell the patient, I need you to put this in your mouth, and what I want you to do is to breathe in and out slowly. And I will turn the flow on and take a deep breath in. I'm going to turn this now to just adjust this. And we'll see the continuous mist. Can you see that with the video camera? Come a little closer, please. I want you to see the mist that's being created. Okay? And I'm going to ask the patient to slowly breathe in and out. And occasionally, I want you to take a deep, deep, deep breath in until you can't take any more in. Deep, 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 deep. Hold it. 1, 2, 3. Exhale. Now we're going to do this for a couple of times. This treatment will probably last about 10 minutes. After this starts to sputter the first time, I'm going to ask, can I please have that for a second? I'm going to tap it a couple of times, and I'm going to ask her to take some more. At this point, it started sputtering a second time, and there's none left on the nebulizer. At this point, I'm going to shut the nebulizer off, and I will place this, just for the time being, back into the treatment bag. At this point, I will ask the patient, how do you feel?
I feel better.
Okay, very good. I need you to do me a favor. I need you to take a deep, deep breath in, and here is some a paper towel, and I want you to cough hard into the paper like this. It's kind of a huff cough. Okay, very good, very good. Did you cough up anything? No. At this point, I would go ahead and check her heart rate, respiratory rate, sat, color, level of dyspnea. I'd listen to her breath sounds again. I'd have her breathe in and out deep. 4 on the front, 4 on the back, 2 on the lower sides. At this point too, I would have the patient repeat her peak flow. And what I need you to do, Miss Stacy, is put this back in your hand, push this point indicator, flow indicator, all the way to the bottom. Again, take a deep, deep breath in as much as you can, put it in your mouth, bite down, and blow out hard and fast. Okay, great. And we would do 3 times, and this time Miss Stacy's peak flow was 450. At that point, I would take this, make sure I put this also in a clean, sterile package. So it says clean for the next time we need to use it. At this time, I would take my nebulizer. If there was any residual medication left over, I would dump it out. I would use a saline bullet, rinse out what's left inside, and then I would hook up my O2 tubing back up to my gas source, and I would turn this on, and I would air dry the nebulizer. After this has been air dried, I would disconnect, and I would place this back into a treatment bag for the next treatment. I would ask the patient how she's feeling. Good. Again, I would reiterate that if she starts feeling any kind of lightheadedness, dizziness, she feels like her heart rate's increasing, or she feels any way abnormal, please let the nurse know, and we'll come back and we'll check on you. Your treatments have been ordered with the Prevenal, 2.5 milligrams of Prevenal every 4 hours. And right now it's almost 2 o'clock, so we should be here probably about 4:30-ish to come and give you another breathing treatment. Okay, so how do you feel now?
I feel really good.
How does your dyspnea feel now? How your shortness of breath?
I feel like it's loosened up a little.
Okay, last time you said it was a 3, 5 being the worst. What would you say it is now?
Probably a 2.
Okay, good, very good. Well, do you have any questions for me?
No.
Okay. At this point, I would go over to the sink, I'd wash my hands, and then I would proceed to the patient's chart, and I would chart what I did with the patient. I chart their heart rate pre and post, respiratory rate pre and post, peak flows pre and post, breath sounds pre and post, and what else did I miss? Heart rate, respiratory rate, sat color, level of dyspnea pre and post, and as if the patient had any kind of adverse reactions to the therapy. Okay, good luck, guys. Get it?